Hi everyone, this is Dr. Heather Austin Robillard, and this lecture will cover the important components to the first module in substance use prevention. You will need to make sure you've completed the assigned reading for this module before listening to this lecture to be able to understand the additional information provided here. The Substance Abuse and Mental Health Services Administration, or SAMHSA, defines prevention as a proactive process that empowers individuals and systems to meet the challenges of life events and transition by creating and reinforcing conditions that promote healthy behaviors and lifestyles. It's important to recognize that there is no specific mention of alcohol or drugs in this definition. This is due in part that SAMHSA includes mental health and has a component of substance use. And there has been a recent movement to incorporate both of them. SAMHSA has also referred to specific goals for substance use prevention to foster a climate in which A, alcohol use is only acceptable during the legal age and only when minimal risk for negative consequences is apparent. Prescription and over-the-counter drugs should be used only for their intended purposes. Other abusive substances, like aerosols, are only used for their intended purposes, and that illegal drugs and tobacco are not used at all. When it comes to becoming a prevention professional, there are 6 domains of prevention that you need to be aware of. The first domain is planning and evaluation, then there's prevention, education, and service delivery, communication and facilitation, community organization, public policy and environmental change, and professional growth and responsibility. Each of these domains have different tasks associated with them. In this course, we will be primarily focusing on the planning and evaluation. However, we will touch on each one of these, and if you are interested in being credentialed as a prevention professional, you will need to be proficient in all 6 domains. Previous framework for prevention has not accurately reflected the interacting pathways and contextual factors related to behavioral health. As a result, the Institute of Medicine developed the IOM model. The IOM model is a continuum of care model summarized in the protractor figure seen here. There are some differences to hold the standard of prevention. Firstly, intervention phases are divided into prevention, treatment, and maintenance. There are distinctions made between these phases. For example, treatment begins only when a diagnosis has been achieved. And in the IOM model, it provides additional distinctions and activities within each of the 3 phases. Let's look at what the role of prevention is. The role of prevention is to create healthy communities in which people have a quality of life. This includes healthy environments at work, school, supportive communities and neighborhoods, connections with families and friends, and a drug and crime-free community. Prevention is a lifelong process, and it should increase the knowledge of the effects of substance use and abuse. It should build skills to increase productive and quality life. It should provide alternative activities other than substance use. It should establish internal and external support systems and increase healthy behaviors for individuals and families. Let's take a few moments to think about our attitudes about drugs when we were growing up. No matter how much knowledge we have as prevention professionals, we are still colored by the attitudes that we've had growing up. It is important to acknowledge those attitudes and learn how to think differently and perceive prevention differently. We have seen an impact on public health approaches to prevention in other areas of our life. Can you think of any? We have impacted preventing deaths from happening in vehicle collisions by just increasing the awareness of wearing seatbelts and even creating fines for people not wearing seatbelts. There has also been campaigns for brushing teeth and taking care of our dental health. And wearing condoms as a way to prevent STIs and STDs or teen pregnancy. So what is it that we want to prevent? Where is the most effective place to implement a prevention program in our community? Do we want to prevent the negative use of drugs and alcohol? Do we want to prevent the overuse and compulsive use of alcohol and drugs? Or do we just want to prevent the use of substances altogether? Once we decide what we want to prevent, where is it the most effective place to implement that within our community? What are the resources that we already have that we can either add on to or that we need to create? Once we have answered those questions, we can start the building blocks for a successful prevention program. Here's some things to be thoughtful of when building a prevention program. Program needs to be based off of sound theory and grounded research. The program needs to be systematically planned and assessed. We need to make sure the staff is knowledgeable and competent. This includes cultural competency. We need to also make sure that they're ethically competent to provide the prevention program. We also need to be informed in the developmental stages of our community or in our targeted audiences and make sure that our program is developmentally appropriate for them. It's important to incorporate the use of media as a way to encourage and advertise for our campaign and our prevention program. And lastly, we need to make sure that it can and is evaluated to determine whether the outcomes have been effective. The cost and benefit of our program. In order to understand that, we need to make sure we're identifying how much time and cost it will be to train and staff our program. It may even cost just to implement the program within a community. Those who participate in the prevention program will be utilizing their time, which may cost them money in other areas. Whatever facility we use to be able to hold the prevention program could cost money. It also needs to be thought of how many years it may take for this program to be implemented and how many years it's going to be run actively and all the costs that will take. The cost developing and evaluating a program, and of course any contributions from funders, the government, foundations, grants. The cost-benefit analysis determines whether a program or a policy application is worthwhile for the investment and how does it compare to the other programs that are already available. The cost of effectiveness measures outcome of the program against the cost. It compares the alternatives and determines which will achieve the outcomes at a lower cost. The return on investment includes the estimates of savings over a period of time due to the reduced demand of health and social services. For every dollar of research or effective prevention we utilize, it can save up to $10 in treatment costs alone. Besides just the financial gains, we also can see the outcome benefit within lower crime rates, an increase in productivity of our community members, decrease in DUI accidents, an increase in life expectancy, and higher employment. Some of the environmental prevention programs that are currently being used all throughout the nation include server training servers to card people for alcohol consumption. This includes fines for serving alcohol to minors. There continues to be drunk driving enforcements, whether that's punitive laws as well as messages and social media discouraging drunk driving, reducing the availability of alcohol to minors, and changes in zoning for consumption and the selling of alcohol. There's also been workplace incentives for employee drug testing or tobacco abstinence. Then we also have counter advertising like Surgeon General warnings, banning of alcohol sponsorship, and anti-drug media campaigns. This lecture was just a brief introduction to prevention within substance use. The goal of this class is to continue your understanding of how to create a prevention program in a community and how to be impactful to reducing substance use.